Saskatchewan's health authority says ICU capacity is nearing 100% after a five-fold increase in COVID-19 cases over the past month. The province recorded 329 new cases today and 4 more deaths. And it's not just hospitals that are feeling the strain. There is growing concern among prison staff and inmates after a spike in cases at a Saskatoon correctional facility. Ryan Kessler reports.
This here's my birthday and his birthday.
Jennifer Lounsbury is desperate to know whether or not her son Alex has COVID-19. He's in the Saskatoon Correctional Centre.
I'm sitting back here and I'm just waiting for them to call me and say that my son has got COVID, and that's what I'm thinking.
As her son awaits sentencing for auto theft, COVID-19 has torn through Saskatoon's jail. In a matter of days, several dozen new cases, nearly all of them inmates. Testing is ongoing, and new prisoners will be sent to jails in Regina and Prince Albert to try to reduce further spread.
It's hard enough when you don't have your son, when they do something, but it's worse when you know that their life's in danger.
The John Howard Society wants more room for inmate distancing, which means reducing jail populations. Prosecutors agreed to release some people awaiting trial this spring, but numbers crept up over the summer, and despite calls for prisoners to get masks, they only became mandatory Thursday.
While I'm happy that they're now being provided masks, it seems as though it may be a bit too little too late.
The jail outbreak is a symptom of widespread community transmission in Saskatchewan. The top sources, places like casinos, bingo halls, and rinks. Rather than close them, the Saskatchewan government reduced their capacity. The premier shooting down a complete or circuit breaker lockdown, saying most businesses are following the rules.
So it would be terribly unfair, and it would have a huge negative impact to close down all of those businesses and put thousands of Saskatchewan people out of work.
With health officials calling current case numbers unsustainable and intensive care units at capacity, the Saskatchewan Union of Nurses considers the province's moves half measures.
Registered nurses are feeling like no one's listening, all the way from the leadership of the province to the public.
A huge challenge has been contact tracing. A single positive case can create hours of work. As a result, provincial and federal government workers, along with employees from Statistics Canada, are being called in to help back up healthcare workers. Chris?
All right, Ryan Kessler in Saskatoon, thank you.